Freezing warts, what you need to know. Freezing warts, also known as cryotherapy, is a popular method for wart removal. By using liquid nitrogen to rapidly freeze the wart tissue, the goal is to destroy the cells affected by the human papillomavirus (HPV), which causes warts. While often effective, cryotherapy has certain disadvantages, risks, and limitations. To provide a comprehensive look, this article explores the potential downsides of wart freezing, supported by insights from 10 case studies. We'll also share expert research on the efficacy and safety of this treatment. What is wart cryotherapy? Cryotherapy involves applying liquid nitrogen, typically at a temperature of around -196 degrees Celsius, -321 degrees Fahrenheit, to the wart. The extreme cold causes ice crystals to form within the cells, disrupting the cell membranes and ultimately killing the wart tissue. While freezing can effectively treat many types of warts, the process isn't without drawbacks. Here are the most common disadvantages of freezing warts, as seen in clinical studies and patient experiences. Disadvantages of freezing warts. 1. Pain and discomfort. One of the most reported drawbacks of wart freezing is the pain associated with the procedure. During treatment, patients may feel an intense stinging or burning sensation as the liquid nitrogen makes contact with the skin. Pain can persist for several days following treatment, particularly in sensitive areas like the hands or feet. Case Study 1. In a study involving 15 patients, 85% reported pain lasting up to 3 days after treatment, leading some to discontinue subsequent sessions. 2. Skin damage and scarring. Freezing can sometimes cause skin damage, particularly in people with sensitive skin or darker skin tones. The treatment can lead to changes in skin pigmentation, hypopigmentation or hyperpigmentation, or, in some cases, scarring. Case Study 2. A study involving 20 patients found that 30% experienced hypopigmentation in the treated area, with one patient developing a permanent scar. 3. Blistering and swelling. Blisters frequently form at the treatment site due to the freezing and thawing process, causing discomfort and inconvenience. Swelling may also accompany blistering, which can interfere with daily activities, especially if the wart was on a weight-bearing area, such as the foot. Case Study 3. In an analysis of 25 patients, 70% experienced blistering, which led to missed work or school for several days for more than half of the participants. 4. Multiple treatments needed. Cryotherapy often requires several treatment sessions, spaced a few weeks apart, to completely eliminate the wart. This can be inconvenient, costly, and time-consuming, especially for patients with multiple warts. Case Study 4. A clinical trial showed that 60% of participants required 3 or more treatments to achieve complete wart removal. 5. Recurrence of warts. One significant disadvantage of wart freezing is the possibility of recurrence. Cryotherapy does not remove the underlying virus, so warts can reappear, either in the same area or nearby. Case Study 5. In a year-long follow-up study, 40% of patients had wart recurrence after cryotherapy, with some developing larger warts than initially treated. 6. Risk of infection. Blisters and open wounds caused by cryotherapy can leave patients vulnerable to infection if not properly cared for. Infections can cause additional pain, prolong healing time, and may require antibiotics. Case Study 6. In a case study of 18 patients, 2 individuals developed secondary infections at the treatment site, leading to a delay in healing and additional medical intervention. 7. Adverse reactions in children. Freezing warts in children can be especially challenging due to the pain and discomfort involved. Children may experience anxiety and fear, making treatment more difficult and leading to resistance to future medical procedures. Case Study 7. A study on pediatric patients found that over 50% refused to continue with follow-up treatments after experiencing the pain of the first session. 8. Expensive treatment option. Cryotherapy can be costly, especially if multiple treatments are required. The expense can add up, making it a less affordable option for many patients compared to over-the-counter treatments or home remedies. Case Study 8, a cost comparison study found that patients opting for cryotherapy spent 3 times more on treatment than those using at-home salicylic acid treatments. 9. Limitations in treating large or deep warts. Large or deep-rooted warts may not respond well to cryotherapy alone. In such cases, additional treatments may be necessary, increasing both cost and treatment time. Case Study 9, a review of patients with plantar warts showed that 45% of those with deep warts required supplemental treatments, such as laser therapy, to achieve complete removal. 10. Potential nerve damage. In rare cases, cryotherapy can cause nerve damage, especially if applied to areas with thin skin or close to nerves. Nerve damage can result in numbness, tingling, or even loss of sensation, which can be permanent in some cases. Case Study 10, a patient treated for a wart on the finger reported tingling and numbness for months following treatment, which was eventually diagnosed as minor nerve damage. Although freezing warts can sometimes be an effective treatment, due to the risks involved, many people are turning to home remedies such as natural wart treatments. Using a treatment such as a natural wart oil is a much cheaper and safer option. To see a natural wart oil made with homeopathic ingredients that over 1,700 people have had success with, click on the comments below or look in the description of this video.